Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. Tonight, we're back to using the old format, which is on this platform called Webinar Jam. And on this platform, the only way we really communicate is you have to write your questions to me. We had been doing these as a Zoom room, but I was really, because of the dialogue format that we were having and people could get into dialogue with me, we weren't getting through a lot of questions. So I decided to go back to this format so that we can work through questions. The other thing that you all should know too is that if you do need more help from me, I am now going to be offering educational health consults beginning in the middle of October. And in mid-November, I'm going back into practice again, treating Lyme disease. So tonight, if there seems to be some things that you just need more input, beginning in October, you will be actually able to schedule for educational visits with me. And in those visits, I won't be able to prescribe or formally diagnose or write orders for you, but I can answer your questions, give you input on things that might be helpful, and give you some ideas to even share with your physician. So that's coming in October. Beginning on probably Wednesday of this coming week, the online scheduler that will allow you to set up those appointments will be open too. And that will be at martyrossmd.com. I'll show you that here in a minute. But that's where you can schedule consult visits with me and eventually full medical service visits as well too. So anyhow, that's some of the changes that are going on here. So anyhow, good to be here with you all tonight. There is a recording that is being completed of this. I am sitting in a different room than typical, and that is I have in the process of selling my home in Austin. And so I have moved full-time into my camper van. And so I'm renting space tonight to visit with you. And beginning on Tuesday, I start driving back to Seattle with a 7 to 10 day motorcycle trip, taking my motorcycle back while the rest of my household will follow. So anyhow, that's what's going on here. There is a recording happening tonight, and look for an email from me in the morning announcing that that is ready for you to see. It should be to you somewhere around 9:30 a.m. to 10:30 a.m. Austin, Texas time. All right. So without any further ado, let's go ahead and get started. I'm going to take the first question, and I'm going to wind up, I'm seeing if it still works this way. Yeah. So I'm going to post this so that it shows on your screen. And if you are in the live version, you'll actually be able to read along with me. If you are watching in a video version, you're going to have to hear my question. So anyhow, let me go ahead and read this question here. So this is from Sherry. Hi, Sherry. Let's see. I have chronic Lyme and am recently experiencing dental issues. Do you have an opinion or anything anecdotal from your own patients on one implant material over another from Lyme sufferers regarding titanium versus zirconia implants? So I don't really have a strong feeling with either one of those. I don't. I just don't have an opinion as to which one is better for you in terms of getting implants. I do have comments to make about things like infection pockets under root canals and things like that, but that's not what you're asking. In terms of implants, I don't have a strong feeling either way, unfortunately. Okay. All right. Good luck to you, Sherry. Thanks for that question. Oh, regarding implants or regarding root canals, one thing you've got to be careful about is some people can get infections under those root canals. You can get little infection pockets, and that can sometimes be the thing that keeps people with Lyme sick. To see if you have root canals and you've been having a hard time recovering from Lyme, sometimes it's useful to have a biologic dentist take a look at you, and biologic dentists have the ability to do x-rays where they can tell if you happen to have infection pockets. If you do, sometimes they have to just remove the whole tooth, or other times they might be able to inject ozone or even hydrogen peroxide into those little infection pockets to take care of it. Okay? All right. Good luck, Sherry. Hello, Melissa. Let's see. Well, let me post that here. Do you have recommendations for supports outside of infection and your standard protocol for a 9-year-old who developed PAN symptoms in conjunction with Lyme and Bartonella? Her psychiatric symptoms have included psychosis, which is fear of bad guys watching, going to get her, cognitive dysfunction, emotional dysregulation, developmental regression, and sensory sensitivities. Over the past 6 months, she has had tremendous progress with many symptoms improving and disappearing, including psychosis and textile sensitivities. She has only been on herbals. Should treatment continue until all psychiatric symptoms resolve? At what point, if ever, would you recommend antibiotics as a final push, even if she continues to improve on herbals? She is starting Methylene Blue. We'll be adding biofilm busters. Lastly, how common are severe neuropsychiatric symptoms like this with Bartonella? Yeah. So PANS and PANDAS are very much related. Basically, they are syndromes where you get acute psychiatric symptoms related to an infection. All right. And one of those infections, the more common infection that many people think about, standard physicians think about, is a strep A infection. However, we also know in the world of tick-borne illnesses that Bartonella can be a big cause of this. So it's appropriate, especially if she tested positive, or even if she didn't test positive, to consider treating Bartonella, all right? In terms of how long would I treat until your psychiatric symptoms are gone? And you possibly could do that with herbals. If you are doing herbals with her and you didn't talk about the herbal antibiotics, I would try to do a full herbal antibiotic, a full court press on the herbal antibiotics, if you will. And in terms of what I would like to do in a situation like this is a triple protocol, 3-product protocol of herbal antibiotics. And that would involve using Cryptolepis. I would also consider using Japanese knotweed, and I would consider using liposomal cinnamon, clove, oregano. Okay, now she's a 9-year-old, so my standard adult dose on the liposomal cinnamon, clove, oregano would be 1 pill 2 times a day. For her, I would probably just do 1 pill 1 time a day. Okay. And then for a 9-year-old, a Japanese knotweed, I might try to dose that up to 15 drops twice a day. And Cryptolepis for Bartonella. This is for Bartonella dosing, not Babesia dosing, but for Bartonella dosing, the way I like to use Cryptolepis would probably be to use about a 1/4 teaspoonful, try to work to 3 times a day on that. Okay, now why am I talking about those 3? Well, number one, we know that Bartonella is hard to treat, okay? And one of the things that makes it hard to treat is it has a growing state and it has persister state, or we call those hibernators or persisters, all right? So you want to be on a protocol that's going to deal with that. So Cryptolepis has good lab evidence that it can help with growing and persisters. Japanese knotweed has good lab evidence that it can help with growing and persisters. And the cinnamon, clove, oregano also has good evidence that it can help with growing and persisters. Okay, so it's a triple press is what I like to do, all right? Now, one of the other reasons I especially like using the cinnamon, clove, oregano here is that those oils are also biofilm busters, all right? And so in getting rid of difficult Bartonella, you need to remove a slime layer that can cover those germs. And the cinnamon, clove, oregano can do that as well too, all right? One other thing you should think about, and this is in adults and even in children, is we know that Bartonella has the ability to wrap itself up inside of your blood clotting protein called fibrin. And so you get these blood clotting proteins wrapped around the germ, and we call them fibrin nests, all right? But those fibrin nests basically take the germs that are kind of rolled up in them, stick themselves on your blood vessel wall, and they kind of get walled off from the immune system seeing them, and also from the rest of from your herbal antibiotics or even prescription antibiotics getting at them. So I would consider, if she was my patient, and you ought to talk with your physician about this, adding in lumbrokinase. Lumbrokinase is a group of enzymes that come from the skin of earthworms. I love this illness. You could tell her she's eating earthworms. I'm sure a 9-year-old would get a kick out of that. But the enzymes from earthworms are great at breaking up fibrin. Okay, a standard adult dose would be to work up to 1 tablet of lumbrokinase, either as a 16 or a 20 milligram pill twice a day. In her age, I might start at 1/2 a pill once a day and see how she tolerates it. But you should run that by her, whoever is managing her, because again, as you start killing germs, you may trigger more Herxheimer reactions, which would give you a psychiatric decline as well too. Okay, so that's one thing you might consider beefing up. And then after she is on that, then I would consider, so the lumbar kinase, in addition to breaking up fibrin in the fibrin nest, will also help to break apart your biofilm. All right, so if she's doing the cinnamon clove oregano, you've already got one thing that's working in that biofilm. What the lumbar kinase does is a biofilm is a sugar slime that's held together in a protein skeleton, and that protein skeleton is fibrin also, okay? So lumbar kinase can help with that too, okay? Now, regarding methylene blue, I like methylene blue. I mean, if you're looking for something, let's say she's already doing these 3 herbal antibiotics that I suggested, and she's not getting all the way there, then I think a nice thing to consider adding to that would be the methylene blue. The reason I like methylene blue is, as many of you may know, methylene blue is a clothing dye, but is also approved as a prescription. And what it has approval for is managing a condition called methemoglobinemia, where your hemoglobin, the protein that carries oxygen within your red blood cells, it doesn't let it go so easily. And there are some people that have that problem and they become oxygen starved. And when they're in acute crisis, what we do is we inject intravenous methylene blue into them, which helps bump the oxygen off the hemoglobin, and they stop being oxygen starved then. Okay, so that's what it's approved for. But there are good laboratory studies that show in the world of Bartonella that it's good at breaking biofilm. Okay, it's also Bartonella biofilm, that is, and it's also good at treating growing and persister Bartonella as well too. So I have a lot of good success in adding that in as well too. I will let you know there's no human safety, long-term safety studies in a child. There aren't even in adults too, but you need to be aware of that. In an adult, I might start at 25 milligrams twice a day. Being a 9-year-old, I might even consider just starting at 12.5 milligrams one time a day to start with. But you'll need to talk that over with her psychiatrist as well too, okay? Keep in mind, if she is on any psychiatry medicines that raise serotonin, that you may need to use methylene blue with caution, because methylene blue is known as an MAO inhibitor, and MAO inhibitors raise the level of serotonin, all right? And so things like Prozac raise serotonin. There's a whole group of drugs that can raise serotonin. So you want to, especially if she's on psychiatric medications, you would want to have your doctors check those to see if they raise serotonin. If they do, then you may need to be cautious about using the methylene blue, okay? And then finally, in terms of designing a very comprehensive Bartonella treatment, again, I sometimes think using 3 things, whether they're herbs or prescriptions, are best. If you get blocked in your herbal, I think a good next step would be to add that methylene blue in. I want to make sure you're doing at least 2 things against biofilm. So lumbar kinase would do that. Cinnamon clove oregano would do that. And then I want to deal with fibrin nest. Lumbar kinase does that. And then finally, another thing that I'm finding very helpful, especially in my LymeUNITED group that I had a while back, when I started suggesting this, we saw a lot of good results, and that is adding in a product which is called arterisol. And arterisol, the key ingredient in it is an extract from green seaweed called ramen sulfate, okay? And what ramen sulfate does is it supports a healthy lining of the inside of your blood vessels, something called the endothelial glycocalyx. One of the things that can happen when you get infection of the cells that line your blood vessels, and Bartonella, one of the things it infects is the endothelium, the layer of cells inside your red blood vessels. It infects them, okay? And because it infects them, that may lead to inflammation and damage of the layer that covers the endothelial cells, which is called the endothelial glycocalyx. Now, the endothelial glycocalyx is very important because when it's functioning well, it has little hair cells that kind of stick up in the flow of blood, all right? And when blood flow hits these little hair cells, it causes the endothelial cells to make nitric oxide, all right? Now, nitric oxide keeps your blood vessels dilated open. So even the real small blood vessels deep in the brain get dilated open. So you got a better chance of the antibiotics getting there, okay, all right? But also nitric oxide is a really good anti-inflammatory too, all right? So if she's blocked in her treatment, another thing to think about adding in here eventually, I'd probably get her on biofilm breakers first, I'd probably get her on taking care of getting rid of those fibrin nests, maybe even methylene blue. But if she's still not getting all the way there, then I would consider adding in this product by Calroy Health Sciences that has ramen sulfate in it, which is called Arterisol, okay? And Arterisol has benefit and support for the endothelial glycocalyx. I will let you know this theory I have of damage to the endothelial glycocalyx. No one has done research on it, which kind of amazes me. We do have research from the world of COVID that showed good benefit in supporting damaged endothelial glycocalyx from COVID. And I think I've seen good benefit in adding that in to treatments or support management systems for people that have Bartonella as well too. All right. So I've said a number of things here. I'm going to do a screen share here. See if I can do that. And I think we'll go here. All right. So I'm going to just show you one thing here. All right. So first of all, I announced tonight that I am opening my practice back up. Okay. This is my website for that. And let me see here. How do we get that so it's big? Huh. Interesting. Oh, I know what I used to do. Hold on here a minute. Okay, there we go. So that's the whole screen right here. Okay. So anyhow, this is it. And if you want to see what I'm offering in my practice, there's two kinds of appointments that you're going to have. And I describe my opening timeline here. October 15th is we're going to start doing the health education consult visits where I give you opinion, but I can't prescribe and I can't formally diagnose and I can't order tests. All right. So those are my consult visits. And then beginning November, December, once I get clinic space, we'll start doing full medical visits. At this point, if you want to join our announcement list so that you get notified when I start taking appointments, my appointment system is working, you would just hit this join list. Okay. All right. And then in terms of things to do for Bartonella. So this is Treat Lyme by Marty Ross MD. You want to go just type in Bartonella and take a look at the Ultimate Bartonella Management Guide here. And in here, I talk about all these ideas I just talked with you about, including Arterisol or the ramen sulfate for the endothelial glycocalyx, okay? And then finally, one other thing in terms of that product. Okay, so this is the product. It's Arterisol, okay? All right, now, many of you may have been following along. My credit card processor for my supplement store closed my account. And I'm having to pursue legal action against them. The trouble is they made it so that I can't get a credit card processor. So you can read about all these great products. I give you a lot of detail in my descriptions, but any product that I recommend, if you want to buy, you would click on this Buy at Marty Ross MD Supplements Femologist store. And I have a partnership with Femologist. They are now representing and selling all of my products. Okay. So you do the purchase over at their site. All right. Okay. Let's go back here. Okay. There we go. All right. Good luck, Melissa. I hope that answered your question. Good luck to your daughter, too. Hello, Thomas. Let's see here. Lots of pain and cracking in the neck, specifically in the back of the head around the occipitals. Is that any particular infection? Also have very bad seborrheic dermatitis on face, chin, head, and skin. Burns, eyes droop. Is this secondary or Lyme skin manifestations? Thank you. How much magnesium? I'm not constipated. Don't know if I need more. What form did everyone go to in place of your previous one? Thank you. All right. Oh, what forum did everyone go to? All right. So I think the forum, you asked what forum did everyone go to in place of your previous one? Again, I was offering earlier this year a community called LymeUNITED. And eventually I decided not to keep doing that. It was taking a lot of my time and it was keeping me away from doing other activities that I needed to. My hope had been with LymeUNITED that people would find it so much beneficial that they would actually subscribe and pay for that service I was offering. But whenever I did try to charge for it, we just didn't have enough people to make it meaningful. So unfortunately, I wasn't supported in my efforts to help you. So I'm not offering that anymore. If you do need some online consult work, I hope you would look at doing my health education consult visit as well too. All right. In terms of other groups that people went to, I can't tell you for sure on that one. Okay. And then in terms of cracking of the neck, we consider that to be a common symptom that is seen in Borrelia. It tends to be a Borrelia symptom. We tend not to see it as much as a Bartonella or as a Babesia symptom, for instance, okay? And then in terms of seborrheic dermatitis, so seborrheic dermatitis, everyone, is a skin condition where you'll get a lot of flaking and burning up in here, sometimes in these areas, sometimes down into the men in the mustache and your beard lines. You can get it behind your ears, and then you can get it up in your hair. When it's up in the hair, we call that dandruff, okay? All right. So whenever I see that seborrheic dermatitis and somebody that's prone to it, it gets worse while they're managing their tick-borne infections, I'm always wondering if they have had some worsening of intestinal yeast overgrowth, all right? So whenever you have too many yeast living in your intestines, it can make any underlying skin condition worse, including seborrheic dermatitis, including pimples and acne, all right? So if you've had a flare in that, I would just briefly look at, do you have symptoms suggesting too many yeast in your intestines? And as you know, anyone that we're treating chronic tick-borne infections with herbal or prescription antibiotics is a setup for getting too many yeast. Symptoms that would make me wonder about too many yeast, in addition to skin manifestations or skin exacerbations, I should say, would be increased sugar cravings. Another symptom might be feeling worse after you have sugars. Another symptom might be gassiness and bloating. In women, having increased vaginal discharge or vaginal itching. And then again, having a decline makes me wonder about it. And then finally, skin outbreaks would make me wonder about that too. Okay. All right. So if you're wondering what to do for too many yeast, I'm going to just do a quick screen share here to show you the resources I have for that. Okay. All right, so what I would do for that is just type up, well, actually, go into the Lymology guides, go to the yeast section here, and you've got two articles you can take a look at. This one called A Silent Problem, Is It Yeast? Does a really good explanation of how do you determine if you have too many yeast. And then this article here, Kills and Prevents Yeast, A Brief Guide, is your good resource about what do you do to get rid of yeast, okay? And then I would point out one other comprehensive article to look at, this one called Your Guide to a Healthy Intestinal Microbiome, even on antibiotics. It's very detailed, but it gives you the key strategies you should use to prevent getting yeast while you're being managed or treated for tick-borne illnesses as well, okay? All right, thanks for that question, Thomas. Good luck to you. Hello, Lori. Let's see. Hi, Dr. Ross. I have Lyme co-infections and recently learned that I have SIBO. I took antibiotics from December until the end of March. At that time, my Lyme doc told me there was nothing else he could do for me. So I started with functional MD. Since late March, he has had me on many supplements for rebuilding my gut immune system, but the only one for Lyme and co-infections was the Return to Healthy Foundation formula. Now that I have the SIBO diagnosis, he still wants to work on that before the Lyme or co-infections. He just started me on DFH, probiotophage, DF for E. coli, Clear Interface Plus to dissolve biofilms, Atrantil to curb bad bacteria, and Chinese skullcap to target high Pseudomonas levels. I'm concerned this is not enough, and also concerned about breaking the biofilms and not taking anything to kill off bacteria. Can you offer any thoughts? All right, so what I can offer is when you have, so SIBO, everyone, stands for small intestinal bacterial overgrowth. And basically your small intestines are not supposed to have many bacteria in them, all right? And if they do, and the way that those bacteria may get up there is you might get some bacteria that migrate up from the large intestines, all right, Also, disturbances occur, and for some reason, being on antibiotics may make it easier for that to happen. That's been what my observation has been, okay? Now, if you get too many bacteria living in your small intestines, they wind up fermenting the food you eat, all right? And as they ferment the food that you eat, it causes a lot of gassiness and bloating and abdominal discomfort, all right? There's a related condition, which is called SIBO, small intestinal fungal overgrowth, which is basically yeast, candida yeast in the intestines too. So whenever I've got somebody that has a lot, so the way that you diagnose SIBO is you can do, the gold standard would be to have a gastroenterologist take a tube, place it down in there and pull liquid out of your intestines, look at it under the microscope and see, are there too many bacteria? All right. But for some reason, they refuse to do that. All right. The next best way to see if you have SIBO is to do a type of breath test. It's called a SIBO breath test. And what happens in the SIBO breath test is you drink a sugar water, and then over the course of 2 or 3 hours, you're going to blow into tubes that collect your breath. And your breath is being collected so they can measure how much hydrogen and how much methane is occurring in that. Okay. And those are fermentation products. All right. All right. Now, the trouble is, and so you would have SIBO if you have elevations of either one of those or both of those. All right. Now, the problem is you can have SIBO and the breath test will miss it 30% of the time. So it's not a perfect test. It will only find SIBO if it's there 70% of the time, but it's the best thing we have going. Okay. All right. Now, I mentioned doing a 2 and a 3 hour test. All right. So if you have severe constipation, and often methane SIBO will give you severe constipation, you need to do a 3 hour collection. If you don't have severe constipation, then a 2 hour collection is adequate. Okay. And your provider can help you arrange that. All right. Now, some providers wrongly diagnose SIBO based on a poop test. And keep in mind, the main bacteria that are showing up in a poop test are mainly from your colon, your large intestines. They're not, they don't give you a fair representation of what is happening in your small intestines. So I don't know how your doctor made this diagnosis, but I just want to point that out to you. Okay. And then finally, you know, I know he's working with the Claire interface, a Trantil. Bear with me. I just need to look up something here real quick. Okay, so a Trantil is a supplement. I'm just trying to see what's in it here. Okay. It's a reasonable herbal antibiotic for the organism, one of the organisms that can lead to SIBO. All right. That would not be my starting point. My starting point, if you have true SIBO based on excess hydrogen or excess methane, not based on a poop test, which is mainly collecting stuff from your large intestines. All right. But if you happen to have it, then I like using a product called Biocidin, actually. So Biocidin has about 10 different herbs in it, including garlic, including oregano. It's got some aloe in it, I believe. It's got a number of other things in it as well, too, that have, there's some limited studies that they've done looking at benefit that people, how people did that have SIBO when they're placed on this group of supplements, and they have pretty good results. And in fact, a number of these herbal compounds, like a Biocidin, there's some studies that suggest about 70% of people can get better with SIBO by using those instead of using prescription protocols. Okay. All right. So I just want to say that to you as well, too. All right. So, all right. So when you have SIBO, it's hard to actually start to deal with your tick-borne infections at the same time. And in fact, often in my practice, I would dial back what I was giving people to kill their tick-borne infections while we got the gut under control. It just becomes really hard to manage if you're on various herbal or prescription antibiotics for tick-borne infections that may be disturbing your good bacterial profile, to also then get better, because you got to deal with SIBO first. It's hard to manage both of them. I have found better results by sometimes just stopping the Borrelia, Babesia, Bartonella treatment and going after SIBO first. So on that point, I would agree with your physician here. Okay. All right. So anyhow, that's a lot of rambling. Let me just, for everyone that needs more information here. All right. What I would do is, let me go over here. Take a look again at Treat Lyme by Marty Ross MD. I'm just going to write in SIBO here. And this is my article about managing SIBO during in Lyme disease, and why you need the kind of the process that you would go about doing it. Okay. All right. And even considering using something called a FODMAP diet, which removes various foods that are more easily fermented by the bacteria. So in some ways, if you are on a low-fat FODMAP diet, you're starving all these bacteria that live in your small intestines. Okay. All right. And that would be an effective part of a treatment as well too. Okay. All right. Okay. Good luck to you, Lori. Hello, Cheryl. Let's see here. There we go. Hi, Dr. Ross. Thank you for being here and helping us. You're welcome. Do you have any advice for someone who has been on antibiotics 3 times in the past few months and also steroids 3 times, and Babesia symptoms getting a lot worse? He has signs of yeast, big pimples come and go on his legs, broke out in fluid-filled blisters on feet, increased fungus on toes, loose stools, and had an allergic reaction to food where he couldn't stop vomiting. LMD does not think it's yeast. She believes it is from Babesia. Also, could his immune system be down from the steroids and possibly causing Babesia symptoms to increase? Do you find problems with Lyme patients on steroids? And if so, what can be done to help them? Also, what are your thoughts on hydroxychloroquine in a Babesia treatment? Thank you for all your education you provide us. Cheryl, you're welcome. All right. So let me see if I can make sure I get through all of those parts of your question here. Bear with me. I just need to see something from your beginning of your question here. Antibiotics 3 times in the past few months and steroids 3 times, and Babesia symptoms getting worse. Okay. So both steroids as well as being on antibiotics are a great setup for developing too many yeast in the intestines, all right? And whenever I'm treating somebody for tick-borne infections, if they have a big decline, one of the first things I'm considering is, did we trigger too many yeast in the intestines by being on either herbal or prescription antibiotics, okay? Add that factor, then add in the fact that there was steroids here. There's a big risk of too many yeast. So I'm not sure that I agree with the LMD. So again, I showed you all earlier tonight the article about how do you diagnose too many yeast, what symptoms to look for. I would take a look at that article and just see for yourself. Do you agree with your LMD, right? Maybe you don't, all right? What I would do in my practice, if I had somebody in this situation, is the first thing I would do is try to develop a good plan to help get the yeast under control. And that would involve being prescriptively, which gives you a 90% chance of helping in about 30 days. I would want to consider trying nystatin as a 500,000 international unit pill, 2 pills twice a day, and diflucan, which is also known as fluconazole, a 200 milligram pill, 1 pill 1 time a day. That combination is generally effective 90% of the time in 30 days at getting intestinal yeast under control. And that's where I would go. Now, if this person, you didn't say you just identified them as someone, I don't know what their relationship is to you, but I'll call them the person, okay? If this person is also still being treated with prescriptive or herbal antimicrobials for Babesia, it would be okay for them to stay on that at the same time while you're actually going after the intestinal yeast, okay? Now, in dealing with intestinal yeast, there's a few other important things you need to do, all right? Number one, I'd like working with a good quality probiotic. And if your family member is having loose stools, that means there is intestinal involvement, which probably means there's some leaky gut. What I'd like to do for my probiotic is to pick a product that has beneficial support for the lining of your large intestines to help heal that leaky gut. And what you want to be on is a product that will increase butyrate production, okay? So butyrate is made by healthy bacteria in the intestines. There is a product called Metabolic Daily made by Pendulum that has Akkermansia in it. And Akkermansia, and then there are 4 other bacteria in it that produce butyrate, okay? What Akkermansia does in there, live Akkermansia, helps rebuild the mucus lining of your intestines to help heal what is known as leaky gut. And then the fermenters in there make butyrate, and then all 5 of those bacteria promote healthy levels of your other healthy bacteria too. So when somebody's having GI symptoms, the probiotic I like to choose to use in addition to nystatin and diflucan to support getting rid of yeast is I like to use, it's a product called Metabolic Daily by Pendulum because it has those active bacteria that at least in laboratory experiments would rebuild the intestinal lining. Okay, and so I would do 2 pills 1 time a day of that, all right? In addition, you need to eat in a way that supports healthy bacteria in the intestines, all right? So there's 2 things that support healthy bacteria. One is to have a lot of polyphenols, all right? So polyphenols are found in colorful fruits and vegetables. They're also found in high amounts in tea and also in coffee, all right? So if you happen to be a big coffee drinker, you're probably getting adequate polyphenols. And then also, if you don't have a lot of colorful fruits and vegetables in your diet, then it might be time to think about actually using a supplement to supplement polyphenols. And there is a product called Polyphenol Booster, also by Pendulum, that is a source of polyphenols. And I would do that as 2 pills 1 time a day. All right. And then the other thing you want to do is make sure that you're feeding a good amount of prebiotic starches. These are non-digestible by us, but they're digested by the bacteria. And if you have a diet that's rich in fruits and vegetables, beans and legumes, you're getting enough prebiotics. But if you don't have a diet that's rich in those, for somebody who has bad yeast, I would also want to get on prebiotics. And a product I like for that is something called Mega Pre by Megaspore Biotic, or Multibiome Labs, I think. But anyhow, it's called Mega Pre, okay? And that's 2 pills 1 time a day, all right? So to get yeast under control, and I wonder about yeast here, I would consider nystatin, diflucan. I would consider doing a polyphenol booster if there's not enough in the diet. I would consider doing a Metabolic Daily to help rebuild and support leaky gut. And then not rebuild leaky gut, but rebuild your lining in support of helping manage leaky gut. And then there was one. Oh, and be on getting enough probiotic or prebiotics as well too. All right. And then finally, let's see here. Yeah, so, having been on steroids, the main thing that you're going to want to do is just manage the effect of it, which is probably you got intestinal yeast. There isn't any other way to overcome. You just have to wait for the effect of being off steroids long enough that the immune system is also going to turn back on, okay? And then regarding your question about hydroxychloroquine. So hydroxychloroquine is known, the brand name is something called Plaquenil, all right? So the number one, Plaquenil, hydroxychloroquine, eons ago used to be a very effective agent against malaria. And as you know, the agents that we use to manage Babesia are antimalarials. What I will let you know is hydroxychloroquine is a horrible antimalarial agent at this point. And in my experience, I don't find it to be that effective for managing Babesia unless it is paired with either primaquine or tefenaquine. In those situations, it may have benefit, okay? But if it's just being used as an anti-Babesia by itself, not a good thing. And the only way I've seen it being used in a beneficial way would be as part of a primaquine or tefenaquine regimen. Those are two places that I've seen it being used, okay? Or that I've had benefit trying it, I should say, okay? All right. Good luck to you, Cheryl. All right, so I'm just a quick screen share here again. Okay, so first of all, again, in terms of yeast management and considering yeast, take a look at my yeast section here. Okay, how do you diagnose right there? How do you manage here? Okay, and again, to support healthy intestinal microbiome, you can look at this article called Your Guide to Healthy Intestinal Microbiome. I also talk about it in my Kills and Prevents Yeast article as well too, okay? And then in terms of the products that I was just talking about, so this is the MegaPre, this is the Megaspore by, the MegaPre is something I would use. I would look also at this product called Polyphenol Booster that I was telling you about. And then finally, this is the Metabolic Daily that I was telling you about as well too. Okay, all right. All right, hello, Amy. I say, hi, Dr. Ross. I took an IGeneX test and it came back as positive serum for tick-borne relapsing fever and Lyme as equivocal. I'm on Methylene Blue, 50 milligrams 2 times a day. I'm hearing mixed reviews on Methylene Blue for tick-borne relapsing fever. Is that the best medication for that in your opinion? I have a lot of neuro issues and joint pain. Any suggestions on a better protocol for tick-borne relapsing fever? I hear it can be a different beast, and I want to tackle this as much as possible. Thank you for all that you do. So if your only problem is tick-borne relapsing fever, and by that I mean if we are absolutely sure that you don't have Bartonella, that you don't have Babesia, that you don't have Borrelia, and by absolutely sure what I mean is testing is not perfect. Okay, I'll say that again. Testing is not perfect. So if you picked up tick-borne relapsing fever, there is a chance you might have also picked up Borrelia, you might have picked up Bartonella, you might have picked up Babesia. All right. So one thing to do, even if tests are negative for those infections, you want to review symptoms that we think could be related to them. So Bartonella symptoms, Babesia symptoms, and even Borrelia symptoms. And if you have enough of them, then sometimes they should be also managed and treated too. All right. So I just want to point that out to you. All right. So if you're looking for ways to diagnose those infections based on symptoms, you would take a look, and I'll show you in a minute. I'll show you the articles. I'm not going to walk through all the symptoms with you right now, but I'll show you the articles that you can review that walk you through the symptoms that would possibly indicate having them, even if your test is negative, okay? Because IGeneX testing is great, but it still will miss it about maybe 6 to 7% of the time, okay? It just will, okay? All right. But if it really is just tick-borne relapsing fever that you have, in my experience, what works best are your tetracyclines. So either minocycline or doxycycline. And minocycline has probably maybe a little bit better brain penetration than doxy does. With minocycline, you tend not to have as much difficulty with sunburning that you would with doxycycline. But either one of them, for an adult, I would dose them at 100 milligrams twice a day. Tick-borne relapsing fever probably does not have the cyst forms. It's not clear from laboratory evidence whether we have persisters or not. And so generally, I just go with straight doxycycline or minocycline when I'm managing tick-borne relapsing fever. Okay. All right. So let me just do a quick screen share again. Oops. I think I'm going to do a screen share. All right. So in terms of symptoms to think about, take a look in my Lymology guide section here. Take a look at how to diagnose. Where are you? Here it is. This section called How to Diagnose. And take a look at my article called How to Diagnose Chronic Lyme Disease. I talked to you about symptoms there. Take a look at how to diagnose Babesia. And in here, I make a solid case that you can do it based on symptoms. And then this article, How to Diagnose Bartonella. And in here, I tell you how to use symptoms to make that diagnosis as well, too. Okay? All right. All right. Good luck to you, Amy. Hello, Linda. Let's see. Hi, Dr. Ross. Thank you for this webinar. You're welcome. Please explain why some people may have a difficult time taking megaspore biotic probiotic and what to do to be able to better tolerate it. I took 1/5 of a capsule 2 days in a row, in addition to abdominal cramping, loose stools, and changes in my bowel movements. I had nausea, bloating, a tender abdomen, cognitive difficulties, and extreme fatigue. I started having these symptoms 3 days after taking the first 1/5 capsule, and the symptoms lasted for 4 days. Would you say that even though I had more symptoms than are listed in your online supplement listing, it might be a sign the probiotic is working, or might there be more going on? Oh boy, that's tough. All right, so I get, if I was managing you and if you were my patient, right? And that's what I mean by managing you. If you were my patient and you had that extreme reaction on a probiotic, I would stop that product. I would wonder if you are reacting to something in the product. It's not just the bacteria, but again, these products have fillers, they have other things in them, okay? So I would probably look at working with a different probiotic, all right? And so you might even look at trying, just go with a single agent probiotic to start with, all right? So Megaspore Biotic is made up of a number of spore-forming probiotics. I also sell in my store another product called Core Biotic. Okay, actually, we're going to pull some things up here. It's probably easier if we just look at bottles together. All right, so let's look at probiotics here somewhere. I've got them. There we go. Okay, so if we look at the Megaspore Biotic, that's this product here. And then what's in it? Here's what's in it. All right, so you have 5 different types of spore-forming bacteria here, okay? And spore forming means that they actually form a hard capsule on themselves. These are bacteria that would normally be found in soil. We don't naturally have these in our intestinal tract. Because they're covered in a hard capsule, they get through the stomach acid very well. And then within the intestines, they don't actually implant. They don't take up shop and start living there. But they do release chemicals that are supposed to help your healthy bacteria that live in the intestine do better, basically, okay? It is possible that for some reason you are reacting to one of these strains. And why it's happening, I don't know, okay? But that's an extreme reaction that you're having, okay? All right, by comparison, when I have somebody that has that kind of reaction, one thing you could look at, I'm just going to do by comparison. This is Core Biotic by Research Nutritionals, all right? And their product has 3 strains in it, and these are different strains than what you had in that other product. So you could give this a try and see, okay? But when I have somebody with that severe reaction, what I'm tending to want to do is to go with a probiotic that has 1 bacterial ingredient only in it. And where I would look at is this Akkermansia product, and which has Akkermansia in it. The other thing is it does have a prebiotic called chicory inulin in it. But generally, I find if people are reactive to other probiotics, this is one that they're going to tend not to be reactive to, okay? The other thing about Akkermansia that's nice about it is live Akkermansia, which is, this is a live version, basically manufactures mucin, that is helps in the manufacture of mucin that lines your intestine. That's a protective layer over your intestinal cells, okay? And it also, Akkermansia sends out signals supporting all the other good bacteria in your intestines, all right? So I would consider this as an alternative product, okay? All right. All right. Good luck to you, Linda. Hello, Craig. Let's see. 3 years ago, M protein was found in my blood plus abnormal FLC ratio, and I'm being monitored. I started at 2 grams per deciliter. Next year, it was 4 grams per liter. And this year, it is 8 grams per liter. If I reach 15 grams, I would only have 2 of the 3 risk factors. Is it a concern for someone with chronic Lyme when it appears to be doubling each year? Many of these symptoms overlap due to chronic Lyme, so it might be difficult to tell if it's progressing symptom-wise. So, Craig, I would need more information about what I'm not recognizing what M protein is, unfortunately. And I wonder if I were to look at your lab studies, I would understand what it is, but I haven't seen a protein labeled that way before. In other words, what you're describing may either be out of my wheelhouse, or it is, you're describing in a way that I'm not recognizing it. Okay, so I'm sorry, I can't answer your question here. Okay, all right. Good luck to you, Craig. Hello, Angel. See, hi, Dr. Ross. I have suspected Bartonella. Arthritic and neurologic symptoms began at age 55. I'm now 69, was treated with a variety of pulsed antibiotics which provided temporary benefits, lots of gut problems, but no lasting progress. I am sensitive to chemical antibiotics and prefer herbal antibiotics. Enjoyed significant benefit with the combo of Japanese knotweed plus cat's claw, but experienced strong estrogenic response and had to stop. Then tried cryptolepis plus Chinese cat's claw with good benefit, but same reaction. Recently used an herbal sleep product and oddly also had estrogenic reaction. How to determine why this is happening and what to do about it so that I can go back to using herbal antibiotics? And a second question, does pulsed electromagnetic field therapy kill BART and Lyme bacteria? Thank you, Angel Binks. All right, so let me try to go through this. So cat's claw and even Chinese cat's claw is known to have estrogenic effects. All right, they are estrogen analogs. They release chemicals that bind to your estrogen receptors and act like estrogen. Okay, so in both of your regimens, the problem was cat's claw probably. In terms of what was in a herbal sleep product, I would need to know more what was in it if I could tell, so I could tell you whether any of those herbs specifically are known to have an estrogen effect. Okay, all right. So part of the problem may just be you took a product that is known to have estrogen effect. All right, and there are other ways to skin the cat. So you could do for Bartonella. I mentioned earlier tonight I like using cryptolepis in combination with Japanese knotweed, and then adding in liposomal cinnamon clove oregano. I like the product called Liposomal Cinnamon Clove Oregano Essentials by Dr. Inspired Formulations. In my experience, I have not seen those to have an estrogenic effect before, okay? in my experience, I have seen the various cat's claw products, varieties of cat's claw, to have an estrogenic side effect. All right. So just keep that in mind. Okay. And then, in terms of how to use those herbs to kill Bartonella, take a look at, I'll show you a couple articles that you can look at that tell you how to do that. Okay. All right. And then, in terms of pulse electromagnetic field therapy, I want to make a distinction. So there are what are known as Rife machines, which emit frequencies that are thought to vibrate, electromagnetic frequencies that are thought to vibrate with the covering of a germ and burst and kill it. Okay. All right. And we know that based on my experience and also based on some research that was done by my Lyme Data, which is a research arm of LymeDisease.org, that in my clinical experience, Rife helps about 35% of people. All right. In the experience of data collected by my Lyme Data, where they enrolled people that have tick-borne infections, and then they periodically will query their database, and I think they're upwards of maybe 1,000 people now. They will periodically go out and query them and ask them questions. And a number of years ago, they did a project where they were asking people, did they try alternative therapies? And when they did alternative therapies, did they get better? And did they have side effects? And their findings on Rife is that it helps about 35% of people. Okay. So a Rife machine is something that emits a frequency that is steady. It's not pulsed. All right. Versus a PEMF, I am not aware of any theory or data that would suggest that it's going to be effective at killing any tick-borne infection. Okay. I get the theory with Rife machines, which is basically you emit a frequency that vibrates with the germ and it bursts it. It's kind of like when you take, you've probably seen these images before of an opera singer standing in front of a glass of water and they're singing at a frequency that bursts the glass. That's the way that continuous discharge of a certain frequency can work to kill germs, all right? But pulsing, I don't think is going to have that same benefit. So anyhow, those are my thoughts on that. Okay. All right. And then in terms of what I was just talking about, where you're going to find information about how to use herbs to manage Bartonella, there's a couple places that you can look. All right. So first of all, I'm just going to do it here. This article called Best Herbal Antibiotic Plants for Lyme, Bartonella, and Babesia is built on my clinical experience, but also data that came out of Johns Hopkins University a number of years ago, okay? And so there's a whole table here of various herbs that have been studied over the last 5 years in laboratory experiments showing what they do. So for instance, garlic is good at killing persister Bartonella. Cryptolepis is good at treating growing and persister Borrelia, growing and persister Bartonella, and is effective at Babesia, for instance. Okay. All right. And in here, then I lay out various protocols that you can use to go after Bartonella, including this one with Japanese knotweed and Cryptolepis. And then there's this one down here where I talk about doing Babesia, Bartonella, Borrelia at the same time, where I talk about crypto, Japanese knotweed, and the liposomal cinnamon, clove, and oregano oil combination. Okay, all right. And then in terms of where this, the products that I would recommend, so in terms of the liposomal cinnamon, clove, oregano essentials, this is the product. And again, if you, oops, how did I get there? If you click on this, it'll bring you over to my partnership with Femologist, where we're selling my products now. Okay. All right. And then in terms of the brand of herbal antibiotics that I like for all other herbal antibiotic tinctures, take a look at my Montana Farmacy page. And this is basically, these are made in small batches by a company up in Eureka, Montana, up near the border. I just find these to be very, very effective products. Okay. All right. So any of these, and again, if you click on them, you can buy them over at my Femologist site partnership as well too. Okay. All right. All right. Good luck to you, Angel. Hello, Obi. Let's see. Hi, I suffer from a Bartonella infection. And to keep things simple, my two most unbearable symptoms are potassium spikes manifesting as severe mental fatigue and seizures. About 6 months ago, I have managed to work up to the proper quantities of the protocol Japanese knotweed cryptolepis and the cinnamon clove oregano pills. It looks like I have made pretty good progress in the sense that mental fatigue level outside of the seizure period days, as well as the seizure intensity, have gone down considerably. Seizures went from grand mal to absence seizures. The seizure frequency, however, has gone up from about 2 to 3 weeks to about 1 a week. But because the recovery period is almost gone, there is no post-seizure depression, and the mental fatigue is more manageable. I actually can't decide if I'm getting better or worse. My question is, when would I give up on the naturopathic treatment and move to full-on antibiotics? Okay, good question. Let me just make some comments here. So Bartonella causes a lot of inflammation in neurologic tissue, and that leads to either overt seizure disorder, the kind that you can see when you hook up the wires to the brain and you get an EEG. All right, that's the kind of seizure patterns that even a neurologist would not miss. Okay, Bartonella can do that. But also in people with tick-borne infections, especially Bartonella, it's very common to have what I will call seizure-like activity that just, they look like seizures, right? But when you hook all the wires up on the brain, the electrical activity that one would expect that neurologists use to diagnose seizures, that activity is not there. And typically when people have these non-EEG recognized seizures, that's always Bartonella. I just see that when you treat Bartonella, when you manage Bartonella, that people tend to get better. Okay. All right. So it appears to me that your management of this is working. What I wonder is if you're having less neurologic symptoms overall, even quicker recovery, but you're getting more frequency of the seizures, what I would wonder is if you still have quite a bit of inflammation from killing of the germs, right? So as you know, whenever you kill the germs, your immune system is going to see the dead bug parts and make more inflammation chemicals called cytokines. And so one thing you may want to consider, I'm not sure if you're doing this right now, but I would be pretty aggressive in terms of trying to manage the inflammatory Herx reaction or killing reaction side effects, if you will. All right. And there's two things I would specifically do if you were in my practice. What I would recommend is, number one, being aggressive with glutathione. You could do that either by taking liposomal glutathione as a 400 to 500 milligrams 2 times a day. The product I like for that is a product made by Research Nutritionals called Trifortify. And their product has good research showing excellent absorption. Okay. And how it works to get inflammation down is 2 things. Number one, it helps remove toxins that are released from killing your germs. Okay. But secondly, whenever you're killing, what triggers your white blood cells to manufacture cytokines, excess cytokines, is an overproduction by your immune system of oxidizing agents. And as you're killing germs, you're going to have a release of a lot more oxidizing agents. And those oxidizing agents trigger the white blood cells to make cytokines, all right? So if you can take glutathione as a strong antioxidant, it's going to lower the oxidizing agents that trigger your white blood cells to make cytokines. Secondly, it's going to help clear some of the toxins that are irritating your nerves, okay? And number 3, glutathione can help heal injured nerves as well, too. It's a very powerful antioxidant that actually helps nerve repair as well, too, okay? Because you want to repair some of the nerve injury that's happened to you as well, too, all right? Second thing to get the inflammation down I would be aggressive with curcumin. And I like using a liposomal curcumin. Curcumin gets inside of your white blood cells and limits their production of cytokines, okay? In addition, there is a brain inflammatory chemical called quinolinic acid, and curcumin can be useful at managing that as well too, all right? Liposomal, I like using liposomal because curcumin in and of itself is not that well absorbed. Turmeric, which it comes from, is just not that well absorbed. The product I like for that, because it's a liposomal product, is called curcumin phytosome made by Thorne. And I would do 500 milligrams 3 times a day. And if you're still very irritated neurologically, I would even consider taking that up to 1,000 milligrams 3 times a day. Okay. All right. Now, one reason that your nerves are irritated is they've been injured. Okay. They're inflamed. And I've talked to you about how to deal with the inflammation part of that from killing, right? But also they're injured. They've been injured. And what gets injured is the covering of your nerves, but also possibly the energy factories in those nerves called mitochondria. The covering of your nerves is made up of a bilipid layer of lipid, bilipid layer of fats, okay? And they're made up of similar fats to what your mitochondria membrane is made up of. So as part of managing somebody that has a lot of neurologic excitability, which is what seizures is, in addition to trying to repair nerve injury on the inside by using glutathione to help repair as an antioxidant, I also like to repair the lipid membranes, all right? And so what I like to use for that is a product by Research Nutritionals called ATP 360. And I would have people take 3 pills 1 time a day. What's in that product that helps support the membranes of your nerve cells is a bunch of phospholipid fats, okay? In addition, it has a number of nutrients in it that support healthy mitochondrial function as well too, all right? So I would consider that, all right? So I would be aggressive at neurologic repair with ATP 360 and glutathione, and I would get aggressive about lowering inflammation with glutathione and curcumin, all right? And because you're improving so well neurologically, I would probably stay on the herbal regimen. I just think you need to kind of tweak it with additional supports, all right? I mean, you could change over to prescriptives, but there's nothing that says they will work any better than what your herbals are here. You've got evidence already that the herbals are working. And I will tell you, in my experience, herbs can be used well beyond 6 months. You could stay on the same regimen for a year, year and a half. As long as it's working, I will have people stay on those type of regimens. Okay. All right. Good luck to you, Obi. I hope that answered your question for you. So let me just do a quick screen share here again, everyone. All right, let's see here. What do I want to do? Okay, so take a look at, what am I going to have you take a look at here? Let's see, where are we here? No, I guess I don't have that article here. Okay. In terms of the ATP 360, again, this is the product I like. It's a good mix of phospholipids. Okay. And then in terms of that Tri-Fortify product, there's a variety of Tri-Fortifys. Okay. Just so you know, there's a variety of Tri-Fortifys. They're basically just different sizes. Okay. But any one of these would work for you. Okay. All right. All right. Let's see here. Hello, Jane. Let's see. Hi, do you have suggestions for coping with alpha-gal? So alpha-gal, everyone, is an allergic condition to a sugar found in red meat, basically, mostly red meat. And what happens is there's a tick called the Lone Star tick. That's not from Texas. Okay. Remember, I'm talking to you from Texas here tonight, but it's not named Lone Star because of Texas. All right. It's named Lone Star because on the back of the tick, it has a white pattern that looks like a Lone Star. All right. So that's why it's named that way. But when the tick, when it bites you, its saliva has a sugar in it that is similar to sugars that are found in red meat. And your body develops an allergic reaction to that sugar in the tick saliva. And then it becomes, that reaction then turns to a reaction against that same item in red meats. All right. So and generally what can happen is if you are very strict about not introducing red meats into your diet and limiting those meats that cause the reaction, and you're strict about keeping them out of your diet for at least 2 years, your immune system should develop less reactivity over time. And eventually, most people can get back to having red meats again, okay? In the beginning of it, you've got to be very, very strict about that. Second thing, other things that can be helpful are to try to manage your mast cells. So your mast cells are where IgE antibodies that attach to these sugars, they wind up landing on a mast cell when they're attached to that substance, okay, and triggering the mast cells to manufacture and release histamines. All right. So what you want to do is you want to stabilize your mast cells. And one of the big things I'd like to do to stabilize mast cells is to have people get on quercetin. Quercetin is a very good mast cell stabilizer. It's a bioflavonoid that is known for stabilizing your mast cells. And it comes as a 250 milligram pill. I recommend a product that has it in it. The product is called curcumin phytosome by Thorne. And I would have people take 250 milligrams, 2 pills 3 times a day. Okay. In addition, I'd like to have people on something called luteolin and a product which is also a bioflavonoid, and it's very potent at stabilizing mast cells as well too. And it can be found in a product called Neuroprotect. Neuroprotect also has some rutin in it and a little bit of quercetin, but not enough to make much of a difference. I would still take quercetin in addition to the amount of luteolin that is found within Neuroprotect. And on the Neuroprotect, I would do a pill 3 times a day for an adult. Okay. All right. So that's avoid red meats, unfortunately. This is not a forever condition. Over time, your body, if you don't keep introducing the red meats to it, the immune system should quiet down. In the meantime, to kind of turn down your oversensitive allergy system, I would work with the quercetin and luteolin. Okay. All right. Good luck to you, Jane. Hello, Nancy. Let's see. I have Borrelia miyamotoi. Am allergic to doxycycline. Is there other antibiotic or natural treatment? Also, could this be the reason I have lost my sense of pain? So everyone, Borrelia miyamotoi is one of the strains of tick-borne relapsing fever. And as I said earlier, probably your tetracyclines are the best. If you're not able to do those, I believe rifampin may be a backup option from a prescription standpoint. Yeah, I think you might find benefit, though, from looking at doing a cinnamon clove oregano that I mentioned earlier. You might even combine that with I would probably combine it with cat's claw and see if you might get some benefit with that. Okay. All right. Those are my thoughts. I hope you're working with a physician on this one, and a Lyme literate doctor as well, too. Okay. All right. Good luck to you. Hello, Paige. Let's see. I have Lyme and Bartonella, probably Babesia and Mycoplasma. I have many symptoms, but the one that is bothering me most lately is the heavy cement-like feeling, walking like Frankenstein. Also a feeling like retaining water, swelling in stomach and underarms. Is this Lyme related or is it something different? So, boy, Paige, I would need to do a lot of follow-up questioning with you here to find out what's going on. And I would also want to know what you're on. So are you on antibiotics right now? Are you not? So that I can determine if some of this is side effects. The symptoms that you're describing don't necessarily pertain to any one of the tick-borne infections. And so I would need to try to figure out more than what I can glean from this. If you are interested and you're still having trouble within a month and a half, again, beginning October 15th, I am going to start doing consult visits, which I'm calling my health education consult service. Okay. And the reason I'm calling it health or educational health, maybe I'm going to call it the educational medical service. Anyhow, the reason I'm calling it educational is since we're doing it by video, and if you are not in Washington State, I cannot be a doctor for you, all right? But I can give you advice, and I can give you advice that I give you in a note are things for you to consider. But if you need prescribing, you would need to get a physician involved, or if you need them to write tests for you. But anyhow, I could help you. I could ask you all those questions in one of my consult visits, all right? So take a look next week and Wednesday. That scheduler should be up so you can start scheduling appointments with me for those consults. When I turn that service, I start doing it in mid-October. Okay? All right. Good luck to you, Paige. I showed you my website earlier, I believe. That's the martyrossmd.com. And on the appointments page, it describes the two types of visits and what it will take to do those. Okay? All right. Good luck to you, Paige. All right, let's see here. Hello, Mindy. Let's see. I suffer from a vaccine injury and long COVID. My antibodies are rising instead of falling, and my symptoms are gut and neurological. What treatments do you see working best? What do you think of vagus nerve injection to reset the nervous system? So I have to be honest with you. I haven't been doing clinical practice for about the last 2.5 years now, right? And I don't have enough experience historically to even speak to managing vaccine injury and long COVID. I'm sorry, I just don't have good practical experience for you here. There are some things that I am very much aware of as I read the literature. And one of those is COVID is particularly harmful to the gut microbiome. So do things to make sure you're protecting your gut. We know that in the injury to the gut that takes place, there is a decreased production of tryptophan out of the intestines. And so people sometimes benefit from raising serotonin either by taking 5-hydroxytryptophan or not. We know that there is injury to the endothelial glycocalyx from studies. And so sometimes people have benefit working with arterisol that I mentioned earlier, which is Raman sulfate, can help support the endothelial glycocalyx. I have had benefit when I was managing a few years ago using low-dose naltrexone at times. I have had benefit in working to support mitochondria when I did this a few years ago, using that ATP 360 and the glutathione. In terms of vagus nerve injections, I'm just not sure. I haven't followed the literature enough to know whether that's a good idea or not. Okay. All right. Now, I assume as I get back into clinical practices, I'm actually having to prescribe things again, that I will be attracting people and then I'll become very knowledgeable on this one. But I'm just, at this point, I'm not as knowledgeable as I should be. Okay. All right. Good luck to you, Mindy. Rose, hi. I appreciate seeing you here. Rose says, hi, Dr. Ross. It's Rose T saying hi. And Rose was a part of my LymeUNITED group. So Rose, I'm glad you migrated over here. That's good. I hope you're well. Hello, Joanne. Let's see. I was bitten by a spider on my toe in Seattle about 3 months ago. and have not been the same since. Very tired, right leg of bite hurt, and cramps up. Now all the joints in that leg hurt. Could I have reactivated Lyme or the treatment for spider venom? Huh. I'm just reading what you said here again. You know, I would need to get into the literature here a little bit to investigate what I'm about ready to say, but Bartonella is transmitted by a number of vectors. I haven't, and although, in the world of Lyme, we tend to think of ticks as being the main transmitter, they're a small group of ticks are probably the minor culprit. There are many other vectors out there that can transmit Bartonella. And so I don't know whether spiders can or not. And I would be wondering, based on what you just said, because the symptoms, as neurologic as they are, make me wonder about Bartonella. I just have to say that. Okay. So I would consider that. I would consider working with your providers to see if they can help you figure out if there's Bartonella here. And it is possible anything that suppresses your immune system or that draws the attention of the immune system away from controlling other germs that may be under control, like maybe a spider bite and venom, could reactivate something. It's possible. All right. So anyhow, those are my thoughts. Okay. All right. Good luck to you, Joanne. Oh, Joanne, I should show you my article on how do you figure out if you have Bartonella based on symptoms, okay? I did show everyone earlier, but just I think we'll do it again just so you can look at that and see, does that make sense to you, okay? Or is it a possibility with what you're describing here, I should say. All right, so take a look in my LymeOlogy guides, take a look at the how to diagnose section here, and then take a look at this article, How to Diagnose Bartonella in Chronic Lyme Disease. I go through a whole list of symptoms that make you wonder if Bartonella is in there. Okay? All right. All right. Good luck, Joanne. Hello, Jacqueline. Let's see. Good evening, Dr. Ross. Question: can 2 milligrams of methylene blue be enough to target Bartonella along with Japanese knotweed, Cryptolepis, cat's claw, and Houttenia, and Campsinidae? This is one I don't know. Campsiandra augustifolia. I haven't heard of that herb before, by the way. So I can't comment on that one specifically. Taking these for Borrelia and Bartonella, I spoke to the company pharmacist who helped develop the dose for Dr. Horowitz when it was repurposed for Lyme. He said that either my doctor is using the dose for mitochondrial support or he's afraid to use higher doses. My doctor will not increase the dose of methylene blue. Also, is it common to have tachycardia at night with Bartonella? Thanks. All right, so that's a low dose for Bartonella. Most of us that are using it to treat Bartonella are going to use somewhere around 25 milligrams twice a day to 50 milligrams twice a day. I've gone up to 100 milligrams twice a day. Horowitz, because he's Dr. Horowitz, throws more of it at Dr. Horowitz likes to use extremely high doses of everything. He likes to use 20 million things at the same time at high doses. That's just what he does, okay? Horowitz will go, I think, up to 600 milligrams a day on his methylene blue dosing, although he's often using it to counter some of the effects of his dapsone. So he's using it to deal with some of the side effects that happen with that, all right? But I find effectiveness usually more around 25 milligrams twice a day, up to 50 milligrams twice a day. There are some of my colleagues that will go more 12.5 milligrams twice a day to start. But I would agree that 2 milligrams, I'm not sure what they're doing. And I'm not even clear that 2 milligrams is going to be enough to support mitochondrial function either, to be quite honest with you, okay? In terms of tachycardia at night, that could be, I would need to ask you a number of questions to see what other symptoms go along with that tachycardia. But tachycardia is likely due to an imbalance in your sympathetic parasympathetic nervous system, basically, where you're getting too much adrenaline released and not enough anti-adrenaline. One thing that you might want to consider that can add balance to that whole system without taking a drug actually would be to use one of these. It's a device called an Apollo Neuro. It's developed by a neurologist. And one of the things it can do is balance the vagal nerve activity. All right, vagus is what controls release of adrenaline and anti-adrenaline. All right. If you want to read more about this device and the science behind it, take a look at here. So take a look at this wearable section here, and this is the Apollo Neuro device, okay? I go through a description of what it does and what it's supposed to do. There's even a video here. I go through benefits, but there's a large number of things, and if it talks to you, you can buy it at the Apollo Neuro website, okay? All right. The device is actually quite effective at helping with sleep as well, too, okay? All right. Let's see here. Go back. There we go. All right, everyone. Listen, it's been fun to be here with you tonight. I've rented this room for 3 more minutes, and I've got to get out of here. I'm going to be off the next 2 weeks, and the reason is I'm actually taking some time to ride my Harley Davidson back up to Seattle. I'm using this as a vacation before I re-engage in clinical care and doing consult visits up there again. So I'm not going to be with you here for the next couple weeks while I ride my motorcycle across Colorado into Utah, along US 50, which is known as the loneliest highway in America. And it's very lonely out there on it. Into Northern California, where I'm going to spend some time at Harbin Hot Springs, up Highway 101 to Eureka, and then along the Oregon coast for a couple days, and then eventually up into Seattle. So anyhow, that's what I'm going to be doing coming up. And so I'll be back here with you again in 3 weeks this time, okay? So keep an eye out for your email tomorrow morning. I will announce when I have handled the video recording of this. And I've actually enjoyed being back in this format again tonight, too. I hope it did work for everyone. And I look forward to seeing you in a few weeks. All right. Good night, everyone.